This is an information for everybody. Like, if you are not feeling fine, you know well, you fit go hospital even if you don't have documents. It's not necessary. They will attend to you.
So this right point that you are saying is the family planning clinic that is in Torino here.
Make you take precaution, make you no die for abortion.
Here we are in a consultorio familiare. It's a family planning center, a place where you can get information and help about sexuality, contraception, pregnancy, maternity, and abortion. You will find midwives, nurses, and gynecologists, as I am, and we will all take care of your physical and psychological well-being. The gynecologist is the doctor who takes care of women's health. He can visit you, can choose a contraceptive method with you, can make checkup visits in pregnancy, and can give you medicine or advice for sexual diseases, menstrual disorders, or other problems. If you are a foreigner and you have regular papers, you have the same rights as Italians to access health services. You just need to have this card that is called tessera sanitaria. But even if you don't have papers, you have the right to receive care for emergency cases, contraception, pregnancy, and abortion. This means that everyone can come to consultorio. So if you want to come, you just need to find one where you live and to make an appointment, even by phone. You will be welcome here, and don't worry, no one would report to the police.
Make you take precaution, make you no die for abortion.
Now I will show you how a gynecological visit goes. This bed is a bit strange, but don't worry. You just lie down and you put your feet here. If you are relaxed, you shouldn't feel any pain at all. And I will be very, very gentle, don't worry. I will put these 2 fingers in your vagina, and afterwards I will use this little tool called speculum to have a look in your vagina to check that everything is alright. Even if it's a bit annoying, remember it's for your well-being and it lasts just a few minutes. I will then measure your pressure with this instrument. It doesn't hurt at all. Then I will take your weight and we can talk about your health. And of course, you can ask as many questions as you want.
Make you take precaution, make you no die for abortion.
Contraception prevents an unwanted pregnancy after having sex with a man. There are different kinds of contraceptive methods: hormonal, mechanical, and natural. The natural ones are much less reliable, so we won't talk about them. Using hormonal contraception, you take a very small dose of hormones every day. This has no bad side effects for your health. It has to be prescribed by the doctor, and it's the doctor's responsibility to recommend you, in some cases, blood tests or gynecological visits before prescribing it. There are 3 possibilities: the vaginal ring, the patch, and the pill. They all work in the same way. They give you hormones that stops ovulation and this avoid fertilization, that is pregnancy. But the woman still has her period, and since you take a very small dose of hormones, the bleeding will be lighter and shorter than usual. Remember, this is absolutely normal. There are different kinds of pills, and it will be the doctor to choose the best one for you, and he will explain you how to use it. But remember, the pill doesn't protect you from sexually transmitted disease. The condom is actually the only method that protects you from them.
Make you take precaution, make you no die for abortion.
The patch and the ring work as well as the pill does. You may prefer them because you don't have to take them every day, and they work properly even in case of vomiting and diarrhea. This is a vaginal ring. It's called anello vaginale in Italian, and it's a flexible and transparent ring. You have to put it in your vagina once a month. You keep it for 3 weeks, and the 4th week you take it off, and you will have your period. It's very easy to insert and remove, and you don't feel it at all, not even while you have sex with your partner, and the man doesn't feel it as well. So, this is a patch. Your body absorbs hormones through the skin. So you stick it on your skin and you keep it for 3 weeks. You actually have to change it every week for 3 weeks. The 4th week you take it out and you will have your period. And don't worry, you can take a bath and you can take a shower. It doesn't come off. You can apply it wherever you want, all over your body, except for the breast. So maybe you can put it on the arm, on the back, on the belly or butt.
Make you take precaution, make you no die for abortion.
Barrier methods prevent the man's sperm from getting to the woman's egg, so that she can't get pregnant. They include the male condom and the diaphragm. The condom has to put on before sex when the penis is erect. If it's used properly, it's a very reliable method, and it's the only one, remember, that protects you from sexually transmitted diseases and AIDS. This is a diaphragm. It has to be placed in your vagina anytime before sex, and it remains there for 6 up to 24 hours. You'd better use additional spermicides too. But it's not very common in Italy, and it doesn't protect you from sexually transmitted diseases either.
Make you take precaution, make you no die for abortion.
Another contraceptive method is the IUD. It's a mechanical contraceptive method. It's a small plastic device. It measures about 2 or 3 centimeters and it has a tiny copper wire on it. It's usually used by women who already had a baby. You can buy it in a pharmacy with a medical prescription. It has to be put inside the uterus by the gynecologist during a visit. Very often, before placing it, the doctor will prescribe you a bacteriological test and a pap test if you didn't do it in the last 3 years. It's actually a very reliable method, and the new models last up to 5 to 10 years.
Make you take precaution, make you no die for abortion.
And what to do if something goes wrong? If you didn't use any contraceptive method, or if it didn't work properly and you don't want to have a baby, you have to know exactly what to do. You can then use emergency contraception. There is a pill that is called the morning after pill that can avoid pregnancy. It's very easy to take. It has no side effects. You can buy it in a pharmacy with a medical prescription. You have to take it within 72 hours from the time you had sex. But the earlier you take it, the better it works.
Make you take precaution, make you no die for abortion.
If more than 72 hours pass from the time you had sex, you'd better take a pregnancy test. Wait at least 20 days from then and ask for a pregnancy test prescription. If you are pregnant, the gynecologist and the midwife will take care of you and will make checkup visits in pregnancy. If you don't want to keep the baby, remember that abortion is legal in Italy, but the intervention is free. It has to be done in hospital within 90 days for the last menstrual period.
Make you take precaution, make you no die for abortion.
You should clean your genitals once a day. When you go to the bathroom, remember to wipe from the front to the back, not the contrary. And it's not necessary to wash yourself inside. This can irritate the vagina. Common soap may be too harsh for your vagina, so use mild soaps, especially made for women. You can get some more information in your consultorio, and you can buy them in a pharmacy or at the supermarket.
Make you take precaution, make you no die for abortion.
It is very important to check regularly your health, even if you feel well and you don't have any symptoms of illness. Have you ever heard of the pap test or the pap smear? It's a medical test for cervical cancer prevention. During the visit, the gynecologist or the midwife will use a speculum and a cotton swab and will wipe the top of your vagina to find out if there is a problem that could become cancer. It doesn't hurt at all, and it is very important. Every woman should do it every 3 years from the time she first has sex until she turns to be 65 years old. You can get some more information in your consultorio. And what about mammography? The mammogram takes a picture of the inside of your breast. It's an important test for early detection of breast cancer. If you are over 50, you should repeat it every 2 years. And you can ask more about this when you talk to your doctor.